My dad would be really grieved to know how my mom suffered. They took such good care of her.
Tamika Dalton spent untold hours at her mother's nursing home window during the long, lonely months of the COVID lockdown. What she saw still haunts her. She says aides would drop off a food tray and leave, although 74-year-old Teresa Dalton couldn't feed herself, and that her mother would be left sitting in her wheelchair much longer than was good for the large sore on her lower back.
She would tell me I've been here for a number of hours. She tried to get someone, she would use her call bell, and no one would come.
This nursing home in Greensboro, North Carolina is where the retired pastor spent the last 2 years of her life. It is one of thousands across the United States where staffing levels, already considered inadequate by many experts, fell even more during the coronavirus pandemic. An Associated Press analysis found that about 1/3 of nursing homes have fewer nurses and aides than before the pandemic. Some 380,000 jobs have been lost, more than 11%, meaning less bathing, longer waits in soiled diapers, and fewer eyes and ears when someone needs help. There is no way of knowing what role, if any, staffing may have played in Teresa Dalton's death. But experts like Professor Charlene Harrington say there is a direct link between staffing and resident health.
Staffing is the key.
Harrington says 75% of facilities were understaffed even before the pandemic. She says it mostly comes down to profits.
The RNs are paid 15% below what a hospital RN is making.
Before COVID, Kristen Pullins was one of 2 nurses on any given shift at Montrose Health Center in southeast Iowa. When she returned last year after a brief layoff, she says she was the only registered nurse for 36 residents.
There's no extra time to spend time with your patients or to do adequate assessments.
She burned out and quit.
I mean, it's unfair for the residents. They're the ones that suffer.
Montrose denied Pullins' allegations and maintained staffing levels are, quote, appropriate. When Teresa Dalton entered Blumenthal Nursing Home in January 2019, Medicare rated the facility 4 out of 5 stars for staffing levels.
It looked like a nice place, and it was only like 3 to 5 minutes away from me.
But Tamika Dalton never thought her mother got the attention she needed, and that the pandemic only made matters worse.
There are times I had to, pick up my phone or drive around to the front, to the receptionist desk, to see if someone could just go ahead and come into her room to, get her some water to help her.
Staffing at Blumenthal is down 25% since Dalton arrived. Its rating in that category now a below-average 2 stars. Blumenthal's owner, Choice Health Management Services, did not respond to requests for comment. But in a letter to state regulators, company attorneys noted that despite repeated inspections, no charges or citations were issued in Dalton's case, and that, quote, the facility never fell below its staffing expectations. When Teresa Dalton contracted COVID in January, the family had her transferred to a hospice facility. Her daughter was holding her hand when she died on February 12th.
She was a person who loved the Lord so much. And just knowing that she was going to leave to meet the greatest love of her life. That she wouldn't have to suffer anymore.
Alan Breed, Associated Press, Greensboro, North Carolina.